It's a situation no one wants to find themselves in, needing an ambulance when one isn't available. This is what happened to David Benedict. A carpenter, he'd been diagnosed with primary progressive MS. He also had a kidney disease and received dialysis treatment at home.
You know, he was a very caring, loving person. He never dwelled on the fact that he had these two terrible diseases. He was always positive and upbeat.
Here's what happened, according to his wife, Carla Demel. On August 8th, Benedict has a severe headache and higher than normal blood pressure. At 5:30 p.m., Demel drives Benedict to Soldiers Memorial Hospital in Middleton. He's treated for a migraine, discharged, and they return home to nearby New Albany. The next day, Benedict finishes dialysis around 4 o'clock. Demel says he became disoriented and weak. She calls paramedics. EHS arrives in 15 minutes. They take him to Soldiers Memorial Hospital where a doctor orders blood work, antivirals, and antibiotics. The doctor says Benedict should be transferred to hospital in Kentville for a CT scan and lumbar puncture. Demel was told an ambulance would become available around 11 p.m., but that was pushed back to 2 a.m. Just before 1 in the morning, Benedict is found partially out of bed. He's unconscious and unresponsive. The doctor tells Demel it was likely a stroke and she must decide about next steps. Knowing her husband's wishes, she requests palliative comfort measures. At 7 a.m., Benedict dies in hospital. He was 54.
I have a lot of anger towards the healthcare system, not the frontline workers, but these policy and decision makers.
A spokesperson for the health authority said the agency relies on its partnership with EHS for patient transfers. EHS officials say they're aware of the situation and looking into it. They say it was very busy with emergency calls during the time frame Benedict was waiting for a transfer, and so non-emergency patient transfers were delayed. Despite the rawness, Demel feels compelled to share the story.
People need to know what can happen to a loved one. Things need to change. Unfortunately, David passed away, and I'm hoping that this will not happen to anyone else because our healthcare in Nova Scotia is in a crisis, and it needs to change.
Demel will get the written autopsy results in the next few months. Michael Gorman, CBC News, New Albany.